Hello, I'm Dr. Vanita Rattan from the Hyperpigmentation Clinic, and this channel is dedicated to skincare for skin of colour. So I did make a video for you on hair growth, and I asked you if you wanted a follow-up video which was on alopecia, and so many of you said yes. So of course I decided to make it for you. So today's video we're going to be covering the causes, the treatment, the symptoms, and also how to prevent it and lifestyle changes that we can make too. So if that sounds good to you, please give me a thumbs up. So what is alopecia areata? So this is basically when your hair falls out in small patches and you literally see like a bald patch on the skin. And the reason is that the immune system is basically attacking the hair follicle. It doesn't just affect the scalp, but it can also affect your eyebrows, your eyelashes, hair on your face and on your body. So the bad news is there's no cure for it. The good news is there is treatment that can slow down hair loss and can help stimulate hair growth again. So starting off with the first option, which is minoxidil, also known as Rogaine. And with this, you apply it twice a day. It works better on a limited patch. And the only thing you need to know is that it's very slow to see results. The next option is corticosteroids, so such as creams or foams that you can get from your doctor. So usually it's prescribed. And what this does is it reduces the inflammation in the hair follicle, which is one of the main reasons for it in the first place. The next option is steroid injections every 1 to 2 months. This will help to stimulate more hair growth. The next option are cortisone tablets. So again, you need to discuss this with your doctor because there are a lot of side effects with it. There are also oral immunosuppressants such as methotrexate. However, you can only really use this for a short amount of time because there are so many side effects with it. For example, increased blood pressure, there's kidney damage, liver damage. And the last option is phototherapy. So how many of you have seen Huda with her little bald spot and she put red light on the scalp in order to stimulate hair growth? So that's another thing that you can do. And in fact, you can even go to your doctor and ask for medication in order to increase your photosensitivity to the light. Now there's many other alternative forms of therapy, things like aromatherapy, acupuncture, microneedling, although there's not much clinical data on it. So I sort of would take that with a pinch of salt just because this whole channel is dedicated to clinical based information and evidence-based information. Because the evidence isn't there, I don't feel comfortable recommending it. So what causes it in the first place? This is an autoimmune condition. This means that you're likely to have had either family history of it or history of other autoimmune conditions such as diabetes type 1 or rheumatoid arthritis. So unlike female pattern hair loss, which is a large area and happens gradually, with alopecia, it's only a few centimeters in diameter. It is good to note that over 5 million people in the US have it. So, you know, you're not alone. This is actually a lot more common than you think it is. I would recommend that you join the National Alopecia Areata Foundation, just so you can stay up to date with latest technology and also discuss with other people strategies which they use to deal with it. So the good news is that there is advances in wig technology, for example. So with wigs, they actually have suction caps if it's active. And so that's one, if you're active and you run around and you do a lot of exercise, then that's a good idea if that, you know, if that sits well with you. And the other thing is with eyebrows, microblading is another really good option if that's the main area that you're losing hair. When it comes to your diet, we really want an anti-inflammatory diet. So that would mean you want to reduce your sugar levels. You'd want to reduce your alcohol content. You'd want to be eating a lot of fruit and vegetables with high antioxidants. So things like broccoli and beetroot or lean meat. Also nuts, seeds, these are all anti-inflammatory. Please do download your free guide for skincare for skin of colour. The link is in the description box below. I'm in the comment section for 1 hour at the launch of every video. So please do subscribe, but also hit that notification bell so you know when I'm there and able to help you. Also, if there's any other videos you want me to make for you, please do write them down below and I'll put them on my to-do list. I do release 5 videos a week, so I'm always looking for new ideas. Thank you very much.